I should keep watching.
Man, ear removal, yeah. What do they pull it now? Is it just earwax?
It's mostly earwax. I mean, you can see the hairs in it too. Like you can tell when they had a haircut because there's like, it's kind of like going back in time, right? Like a core sample. You're like, oh, there you had a haircut at this point because there's all the little hairs. But the biggest thing is just making sure the camera quality is, because like there's all kinds of doctors now posting videos like that, and you know, when the audio quality and the video quality sucks, like it's almost not worth tuning into. Right?
Yeah, people demand a lot now, right?
Yeah,
because there's good technology out there, everything has to be pretty good.
Yeah.
But I used a point and shoot camera for the first year and a half. I just got this camera like 6 months ago.
Yeah. Well, and I never had an issue with the quality you were putting out, because I mean, there's nothing wrong with, like, as long as it's set up properly, there's nothing wrong with a point and shoot.
Yeah, it's true.
That's what a lot of like vloggers and stuff use, are just point and shoot cameras for YouTube videos.
So look at the full dressing.
That's right.
You get the full experience today. So how was that going through the injection? Was it bad?
No. I mean, well, the left toe.
That one side, it made you.
That was pretty bad, but I could suck it up. I can't feel anything now, so it couldn't have been that bad, right?
So what are we doing now?
Well, we're gonna throw a tourniquet on there so the blood doesn't dilute the acid.
I really don't have to say anything anymore. It's amazing. You know the whole shebang.
Yeah.
Does it get boring hearing the same thing over and over?
No, I think it's good because well, now that I know the script, I kind of know all the reasons why you do certain things, right? So.
Yeah, the big thing, like the way I like to practice is just making sure you know exactly what's going on.
Yeah.
I hear stories about people going into a place not even knowing. They're just going for a consult, and the next thing you know, they're getting injected and nails ripped out.
Yeah.
Not knowing why or what's going to happen afterwards. But I'm surprised, 6 years old to have a surgery. It's pretty young.
Yeah. It was really badly infected because I didn't tell anybody until it got really bad. I was like, oh, my toe hurts.
Yeah. We're going to do a quick little check.
Yep.
Anything sensitive here?
Nope.
How about on this side?
Nope.
Here?
Nope.
Over here?
Nope.
And how about down here?
Nope.
Nice. I see that little nail split that you're talking about.
Oh, okay. So it wasn't a figment of my imagination?
No. So when we try to remove a toenail and we get a regrowth, that's where it's almost literally like a separate little nail.
Okay.
So you're able to watch the videos. You think you're gonna watch today?
No, I'll probably just look over here in the corner, and actually, it's pretty funny watching her reactions to to what you're doing. So that's entertainment enough for me.
Did the nail change right away after they did it, or has it been just over the last 20 years that you noticed it change?
No, it grew back jagged and jacked up like that right from the get-go.
Yeah, there's a little nail split on the side. Oh, you're really holding on. You're not going for it, huh? So then, what's your favorite video?
I really like the wart removal videos. It's just.
Look at your face.
Yeah, no, they're. It's interesting watching you very delicately fillet around it with the scalpel.
This is a really jacked up nail, as you would say.
Yes, yeah.
It is not looking normal at all.
Oh wow, look at that. Once you wipe the blood away, I can look.
It's not bad, right?
Yeah.
Look at that.
That's crazy.
So you see how this is really long here and not long there? I'm really interested if there's something left behind or if the nail's really that damaged. That's why it's growing completely different.
Yeah.
That little side piece did not come out with it, so it's actually separate. So it was really, like you said, like a separate little nail.
Right.
There it is. That's the second piece.
Oh wow, that was hiding down in there, right?
Yeah, so you can see it's like a completely separate nail, like a little nail spike.
Right. Wow. Huh.
So
it's like a lost and found in there.
it is. Yeah, that is really weird because there's no long white part of that nail underneath the center portion.
Right.
I sliced my finger yesterday. I was putting out the garbage and there was a knife or a can or something. So when I pushed it down the chute, it cut almost the top half of my finger off. But I had to go to work, so I literally just taped it up and I worked yesterday. I should have gone to get stitches, but yeah, I'm just fighting on. But when I saw it, I got lightheaded, and I was like, it's crazy when it's to yourself.
Yeah.
You can watch other people get all that happen to them. But
Oh yeah, I can watch every single video, and I'll watch my own video.
Just don't want to watch it while it's
So
happening.
huge pocket on that side where that little nail spike was.
Okay.
Same with that side. So we could see like that kind of long root was definitely deep in the corners, but in the center, there is no extra
not
nail.
much
There's
there,
nothing. No. So what I'm actually going to do to be safe, I'm actually going to get a scalpel and really open up that area just to make sure that there's nothing hiding underneath.
All right.
Because it's funny that it came out so small. And if I just put the acid there, and let's say there is new root hanging underneath, we will get a regrowth.
Right. So we're gonna do some exploratory surgery.
That's right. I will be Dora today.
Oh, is that a copyright strike?
No, I'll be okay. So all I'm doing is just making a little nick and opening that up a little bit. It's one of my little tricks with experience to try to get a better look. So no pain though?
No pain.
Yeah, nothing's probing deeper, so
Actually, funnily enough, too, when they initially did the surgery and I went back to the doctor to get the stitches removed, he actually left a stitch in. So about a month later, my toe started hurting again, and I had to go to my family doctor. He had to like dig it because the skin had grown totally over it. He
oh
actually
jeez.
had to dig the stitch out about
You
a
had to
month later. Yeah.
Oh my gosh.
Yeah, because they didn't use the dissolving stitches. So.
So there you go. There's that deep corner.
Okay. Wow.
It is super deep all the way in here.
Wow.
And so, yeah, the nail bed's not flat at all, completely round. That's why the nail's following it as well.
Right. Now, would that have got damaged during the surgery? Like, you were probably just a little too careless rooting around, or?
It can be, but the truth is nails are just so fragile. Like the nail bed, like there's people that drop one thing on their toe and the nail's done for life. So I think it's just any sort of trauma. So you have to be really careful. So all those nail removals that you see me, that's why we use such a thin piece of metal. I'll show you while I'm putting acid.
Right.
It's very thin, just to lightly or gently separate in between the nail and the nail bed. I'm not poking into the nail bed.
Right.
I'm actually angling it up against the nail, so I'm just trying to separate it as gently as I can.
Right.
Just to prevent damage. If I wasn't doing this, I'd be teaching. I'd love to teach.
Yeah. So
Yeah.
what's the record of the most amount of phenol Q-tips that you've used on a toe?
Jeez. I don't know. I usually use 4 per side, and when I'm doing like a full nail, I'll use 4 rounds of 2. So yeah, around 8.
Okay.
Around 8. I'm a little aggressive with the acid, but hey, we don't want a regrowth.
Yeah.
So it's better to have sometimes a little bit more of a burn or a little bit more discomfort, but no more new nail coming in.
Yeah. Yeah.
But you see how deep this is on the sides?
Yeah.
So you gotta make sure everything gets touched.
Yeah.
What happens when we have that little nail spike, it actually creates like a channel separate. So that's why I actually use the scalpel to break any barrier
Yep.
and make sure the acid can go back and forth. And then here, I really gotta make sure that that front, even though it's not too deep, I open it up just a little bit, gets touched with all the acid.
And as soon as it touches it, does it kill it, or does it have to kind of?
It takes some time. Yeah, it's just for a bit. So normally they say around 3 to 4 applications every 30 seconds or 45 seconds.
Okay.
I go a little bit shorter time, but more. 4 or 5.
Yep.
And just keep it fresh.
Now this might be a stupid question, but
There's no
what,
stupid
what
question. There's no stupid question.
for, like the electric cautery, like that would have no use here.
It does. So people use that, but I find that it's not as effective as the acid. The reason is this acid floods the area. And so if there's any little crevice, the liquid can get in there. But with electrocautery, you actually have to touch the nail matrix itself. So if you miss a piece, so if you're not really aggressive burning it, you're going to miss a piece.
Right.
So I used to use it every now and then, and I found that I had actually regrowths more often with the electrocautery.
Now, which one causes more trauma, the electric cautery or the acid?
the acid.
Yeah.
Yeah, it's pretty toxic and pretty strong, but we're basically chemically burning the skin.
Yes, yeah, for sure, yeah.
So this is, again, rubbing alcohol.
Neutralize the acid.
There you go, I don't even have to say it. And then we put on cream. That was it.
That's it, that's all, eh? That's
Yeah.
all she wrote. Got the antibiotic cream, some gauze.
Yep.
Do that twice a day.
I'm not even going to talk anymore. I'll just let you narrate the whole video. You're
Shower in
good.
the morning with,
Oh my gosh,
and
yeah.
then change it after the shower.
I have a feeling, seeing how your nails were, that you're going to be a bleeder. Just because
Probably.
it was really deep, those edges.
I've been known to bleed.
Good. Means you're alive, so that's good.
Yeah.
If it bleeds through the bandage, you just have to take it off and put a new one on.
Very good.
Yeah, it's crazy when I go to the other room because I'm a lefty. So when everything's on my
okay.
right, I do feel so
Oh, so you're
different.
backwards.
Yeah.
I'm sorry to hear that.
No, it's all good. For the show, the chair actually goes on this side of the room.
Oh.
And so I had to put everything on my right side. So it really forced me to do everything differently.
Okay.
But it was okay. Like I cut nails with both hands. I do a lot of stuff with both hands,
Yeah.
but to grab things and to feel more comfortable, everything was just thrown off.
Interesting.
So what other questions do you have? Now's your time to ask me so many questions. What do you think people want to know? What do you want to know more? After I do this last check.
All right. Yeah, because I got to look where else I might faint on. No.
Anything sharp here?
No, nothing.
Here?
Nope.
On this side?
Nope.
And down here?
Nope.
Nice.
Has anybody pretended?
They have, and it freaks me out. Even though I know they're
I
joking.
thought about doing it. I was like, you know what? I'm not going to do that to the toe, bro.
It scared me, right? Because no matter how many times I do this, every time I go in here, I am always hesitant because
Yeah.
you never know, right? And I was like, I hope they don't feel anything.
Yeah. Well, in that most recent, well, not the 2 videos ago, the double removal you just
Yep.
posted. That guy, he could just
He
feel a little
just-
bit
yeah.
just in the middle there. So
So you know what it feels like? It feels like the toothpick. So you know when I test the toe and you feel like, oh, I feel something a little sharp?
Yeah.
It's like that.
Yeah.
It's not like a...
yeah,
It's just like,
it's not
oh.
excruciating. It's like I could survive through this, but
So nails are lifted. So you have the nail surgery on this side.
that's correct. You know, I'm curious how well of it, if there's any. I mean, I said, I haven't had any issues, so there shouldn't.
No,
be anything
you can see the
on
nail is flat. It's straight across.
Yep.
There's no issue there.
I'm curious how deep that one is, though.
So let's see. Let me grab it right where the skin and the nail meet. So anything on the outside of it would be in your skin. So all that
Wow,
was
okay.
more into the skin.
Not as deep as I thought it'd be, but. I was trying to go for the record. Sorry to disappoint all you viewers.
So that weird tissue here
Yeah.
is all scar tissue from the day you had that procedure. So I'm going
Right.
to trim it off or scrape it off. So that way when it heals, it'll heal much smoother.
Okay.
Do you get grossed out when I cut all that hunk of meat off?
No. That's interesting.
Do you watch any of the videos or no?
Sometimes.
Yeah, you're forced to, huh?
Yeah, sometimes.
Hey, look at this.
I'm a little grossed out, but like I can't not look.
No pain, right?
No.
Yeah, hit me with the questions. Now's the time to ask all those things.
Well, yeah, because
Anything.
I was curious about that little bit of tissue. Like, if he had have removed, like you said, that hypergranulation tissue at the time of the surgery, would I have had that little nub of stuff there?
Possibly, because it's almost like a scar.
Right.
And scar tissue does its own thing. It heals the way it wants to.
Right.
And we can't really predict how well scar tissue heals.
Yeah.
So it might have still been the same even if we cut out that tissue.
Right.
Big thing, same thing, is just trim a little bit of a mark down there just because to open it up. So if there's a little piece of nail, that medicine or the acid can get in there.
Yeah. What's the most common problem that you treat at the clinic here?
Number 1, ingrowns.
Yeah.
2, nail fungus. And 3, warts.
Okay.
And then, of course, I have the corns, calluses, long toenails,
Yeah.
all that stuff.
Yeah. Those videos are really satisfying too when you get the eye out of the corn. So,
The problem with the corns, it's hard to film because it's like the wart.
Right.
Because I'm by myself, it's over the shoulder, and my hands are right in the area of treatment.
yeah.
So the view's not good, but I do have some good callus ones coming up.
Okay.
That I just filmed, where the whole foot's covered with hard skin, and I'm just
Okay.
scraping.
Yeah. You probably feel like a wood carver at the end of that with just a pile of
Oh yeah,
dead
yeah.
skin on the floor. I saw an Instagram video of it was, I don't know where in the world it was somewhere not in Canada, and this guy literally just took a knife and cut a hunk.
I saw
off the
that. I
bottom
saw
of his
that.
foot.
That's crazy. I think it was South America or something. It was crazy.
Yeah. Oh, it was. I was like, what?
I've been seeing a few comments for this guy, dead man walking or something, who has like all this hard skin on his foot. Like it's the same kind of disorder, and people are like, "Oh, you need to help him." The problem with that kind of condition is that it's genetic. No matter how much I scrape down,
Right.
it's gonna come right back.
Right.
So when I have people who come in with that same condition, what I tell them is they got to start figuring out a way how they can maintain their feet themselves.
Right.
Because no one's going to be able to spend as much time as they can. So they have to stay flexible.
Right.
They have to find the right tool that's able to really scrape as much of the dead skin as they can just to keep them comfortable. But really it's about just routine care,
Yeah.
which is tough.
Yeah. Yeah. Like you with your little Funyuns on the side of your toe.
What are Funyuns?
Wow, she got a bump.
I
Little
just
bump,
like
that's a-
scraped them all down.
So have you ever had an ultrasound or an x-ray?
No.
So to me it looks like a little cyst.
Yeah.
Yeah, I see it quite often. So it's right under a joint, and
I've
sometimes,
heard.
yeah, you can get these little skin cysts or bumps. But that's what it looks like.
Yeah.
And they won't go away until they're cut out. But sometimes they form because of pressure. So the fact that they're right underneath the big toe might always be coming back. So you just keep filing down the fun bumps.
Yeah. Yeah, she gets that pumice stone. She's working on it.
Work in progress.
She didn't even know what a pumice stone was.
So what's next? Next question. Now's your time.
Next question.
Or observation or critique. I'm very open to all that.
Can you ever see yourself getting sick and tired of this?
I wish I could just work less and then just do like really fun cases and do this
Right.
more often. So no, I do enjoy doing this.
Yeah.
The problem is now I'm seeing, like almost 130, 120, 150 people a week. And I'm just, it's a lot. It's
Yeah.
the grind.
Yeah.
So I try to make it as fun as I can for myself, but it is tiring. So if I could see less people and, then I won't burn out.
Right.
Because it's fun. End of the day, I have a lot of fun doing it.
That's good. Yeah. Well, and yeah, you got to make sure you don't burn out because even if we got a few less videos, it'd be
But
make sure to
I don't know if you noticed, I've been doing Tuesday and Thursday.
Yeah.
Every Tuesday and Thursday
Yeah.
twice for the last, I think, month.
Yeah. You've been pumping out the content.
That was it.
All right.
It's not that crazy of a procedure, right?
No.
What I would love to be able to do, actually, now I'll bring it up on camera, is I actually would love to go around and train, other doctors or medical professionals, emergency staff who see ingrown toenails or nails,
Right.
and just give them some quick tips and go through a quick way to deal with them a lot easier, because I feel there's not a lot of knowledge for them.
Yeah.
They don't spend enough time on the feet,
Yep.
and they could probably do a much better job, and for the patient and for themselves, just a little bit more advice.
Yep. Well, yeah, because this, to use that video with the double, it was supposed to be a triple removal, but the emerge just removed it, right? But they didn't actually kill the nail; they just removed it. So it'll just come back again, like you said, in another 6 months. He's going to be dealing with the same
I know.
issue.
I know. I would love to go. I'm half Filipino. I would love to go to the Philippines
Okay.
and do some work with some medical staff down there in the hospital. I would love to be able to travel relatively for free and get
Yeah.
paid to do education stuff.
Yeah.
And
Yeah.
so that's why
I can tell you got that teacher bug.
it's fun.
Yeah.
It's fun.
Yeah. And how many languages do you actually speak? Because I know you've mentioned off and on camera. Like, I think you're what, 3 languages?
Three.
Four? Yeah.
It's English and Spanish now, and now my French is really going down.
Yeah.
Because I'm not using it at all anymore.
Okay.
But yeah, that's the 3. And then of course they pick up a little bit from people, and
Yeah.
so that's it, man.
Nice.
It wasn't that crazy, right?
No.
And you looked a little bit.
I did, yeah. I was surprised at this. I actually watched you extract the nail on this side.
Once
so.
people know it's like numb,
Yeah.
like it's the fear out, right?
Yeah, for sure.
So was it to be on the other side? Was it like to actually be
You know, it's pretty cool. I get to be in my own video, so that's, I'm going to be YouTube famous now.
Is it kind of disappointing though versus like watching it and being it, or is it very different, the same?
No, it was, like you said, I was actually able to watch a bit, so it's obviously a lot different watching it in first person than through the camera, but
It is.
it's, yeah, no, that was a...
Well, we got some cool pieces. We'll
Yeah.
take some nice pictures of that.
Awesome.
So it's really